Our pets are more than just furry friends. They are members of our families. But what do you do when they face a medical emergency that needs emergency care? How do you pay for it? Depending on the emergency, that care can cost anywhere between $250 to $10,000. Now, those numbers are according to Care Credit. That is a hefty sum to pay out of the blue for sure. Dr. Kelley Gebhardt is a veterinarian at Happy Tails Veterinary Emergency Clinic here in Greensboro. She's here to talk about the best ways to respond and pay for pet emergencies. Now, this is your chance, folks, to ask a vet a question. You've been wanting to ask your veterinarian a question. You haven't been able to make it by the office. Here's how you do it. You text your question 336-379-5775. All right, so you're speaking on behalf as a vet, but also a pet owner yourself who has been in these situations.
Yeah. So none of us ever want to have an emergency, and heaven forbid when they happen. It always feels like it's absolutely the worst time, both in time of life, whatever we're doing, plus financially, we always feel like we can't afford it. And so while we never want to expect them to happen, we definitely think we can be prepared for them, right? So preparing for an emergency is going to help you in those moments when the emergency actually happens. So being prepared is important. And one of the ways in which to be prepared is to prepare financially for those unexpected times when your pet gets sick or injured, because they can be very financially significant. And one of the best things I think is, there are a few things you can do, but one of the best things I think is to explore pet insurance. They have a lot of options now. It's come a long way over the past 10 years. There's ones that are designed just for illness and injury, and some that have wellness plans, and some that have direct pay to veterinarians like Trupanion. I use that personally, and we accept that at Happy Tails.
Okay.
And what that means is that Trupanion will do a direct pay after the visit or the estimate is approved. They will directly pay the clinic, which actually saves you from paying up front and waiting for reimbursement, which really lifts the burden of the financial burden of that emergency visit. Some other really good options to think about and consider are Care Credit. It's a medical credit card designed for human, dental, and veterinary medical needs. It has different payment plans for different periods of time at different interest rates that you can work out with Care Credit, but it's a payment plan that provides you with that financial flexibility to provide your pet the care they need in the moment and alleviate some of that financial burden. There's Scratch Pay. That's something we accept. Not everybody accepts it, but we accept it. It's a one-time loan, no hidden fees. The interest rate and payment plans are varied depending on what you agree with Scratch Pay. That's something individual for each person. Some other things you may want to consider is a personal emergency credit card, just a credit card that you save and you tuck away for those pet emergencies. That can really help as well. And then a personal pet health savings account. Put a little money away every month, and you'll have that money saved for those pet emergencies for those unexpected times. But those are some really good options.
All right, so we had a whole list there of different ways that we could pay. Let's dive a little bit more into the health insurance again. Why is it so important to have?
Right. So it's to help cover illness and injury. And some of the plans do have wellness plans, which are different from any wellness plans offered through your primary veterinarian. They're very different. If you do choose a plan with a wellness plan, then oftentimes the premiums will be higher. They have a lower percent return for reimbursements, and they might have a cap on the reimbursements. So the wellness plans do have some limited benefits that other plans don't, but they also have some limitations that other plans without wellness plans that they don't have. So like Trupanion, for instance, I'll talk about that because I have personal experience with it and we use it at the clinic, but there are lots of other options out there. But Trupanion has a 90% reimbursement after your deductible, and it's unlimited. So they won't cap it. You don't have like a certain amount of financial reimbursement throughout the year. And a couple of examples for that is, I was calling Trupanion to get a little more information for this episode, and they gave me an example of a case of a pet that was treated for ivermectin toxicity. That pet's total medical bill was $75,000, and they reimbursed 90% of that to the owner. So that's an enormous financial reimbursement and really alleviated so much of the financial burden to treat that pet.
I mean, hearing 90%, getting 90% back is like amazing. I'm guessing because it's going to work like a premium, just like it does for our own health insurance, depending on how old our pet is.
Yes, and so some plans do have like age-related increases, but others don't. It's very variable. So there's actually a website you can go to called petinsurancuniversity.com, and that is written by a veterinarian and designed to help you navigate through all the weeds of all of these options. There's so much information, so many options, and it helps you navigate through to find a plan that works best for you and your pet. So that's one thing that can really help. And the other really important thing to know about pet insurance is that you have to have it on board before the emergency happens, before the illness or injury happens. You can't apply for it at the time of illness or injury, because then it won't be covered and it will actually be considered a pre-existing condition. So if you get a new puppy, if you have a young dog, middle-aged, old dog, explore those options, because you just never know when you might need it. And an old dog can still benefit from pet insurance, because say, what if your dog goes into heart failure 6 months to a year after you get your pet insurance? It's covered by pet insurance, the treatments, and it may enable you to provide more care for your pet than otherwise would be able to.
Okay, so kind of like, I'll use myself as an example. So my dog had to have knee replacement surgery. Okay, so she had to have ACL. So she had that done. If I got pet insurance now, they wouldn't cover that, but they would cover if I needed to bring her in for a snake bite or something like that.
Exactly. It's perfect. Perfect example. It's true, because her ruptured cruciate ligaments are now considered a pre-existing condition. So if she ruptures her other one, it probably wouldn't be covered.
Okay. All right. So we're going to talk about pet health insurance, the savings account, and how that works coming up, and also some other ways to cover the cost. We're going to take a quick break, and then we're going to come back with a little bit more of that and your questions. We'll be right back.